Welcome back. I'm Brent Meredith. Finding a physician or a doctor's office where you feel comfortable and safe is important to everyone. That said, it can be especially difficult for the LGBT community. We have to consider not only how the physician will treat us, but also how the other office staff and patients will welcome us. Joining me tonight to share how they plan to make all their patients feel at ease is Maness Family Practice co-owner Kevin Fuller. Welcome, Kevin. Good to see you.
Hello. How are you, Brent?
Good. I'm doing well. Thanks for coming. Now, before we dive into what makes your practice unique, give us a little bit of background about yourself and Joseph.
Well, Joseph and I met about 8 years ago.
Okay.
He's originally from West Tennessee. I moved actually to Memphis, Tennessee for him. And then he moved back here to Nashville with me. He's been here, and we've been back in Nashville for about 5 years. He worked at a previous place, however, changed and wanted to open his own clinic, and here we go.
So he's been a physician or a nurse practitioner, right?
He's been a nurse practitioner for about 18 years.
Oh, wow. Okay.
Prior to that, he was a nurse for 10. So, in essence, about 28-year span of experience in practicing in medicine.
Cool. So now, what was the catalyst that sort of made you guys say, I know you said he wanted to start something new, but what made you say we want to do this, and this is how we want to do it, and we're going to do it in Nashville?
Long story. Joseph almost died about a year and a half ago. Where he worked previously, said they couldn't hold his job. So after that, a wonderful lady by the name of Sharon Wycheck, which is probably well known in Nashville, gave us the opportunity financially and support-wise to be able to open this clinic. And what we wanted to give to the LGBT community, along with Joseph's patients, along with anybody else, as yourself. If you went to a doctor, they come and sit at a computer and they look and they go ask you questions and they never look at you. They just kind of treat you like a number. Well, that's not the case where we are. We're concerned legitimately for the well-being, and you're not a dollar. I'm sorry. I hate to put it that way.
And I mean, that makes total sense. And like I was saying in the intro, what you and I had talked about the other day was that it's often somewhat a little bit more challenging, because I know you want to reach out to the trans community.
Absolutely.
And you have members of our community, and oftentimes you go to the doctor, and maybe if you're new to that position, it's just a little bit more difficult. And I know you guys want to make that more comfortable for folks.
Well, consistently what we hear from the LGBT community, the trans community, and or gay men and women, or bisexual individuals, they tend to feel that they are judged immediately from the physicians and or doctor's offices in the area, in this general region. I don't know if that's their perception or if that is a reality, but usually people's perception is their reality. So,
well, and I have a really good physician I've been going to for a while, but there's been instances where I've gone to walk-in clinics, and there are some, even just giving blood sometimes, there's those questions where you're just made to feel like you're not welcome.
Well, that's called universal precautions, and they should all know that. If they don't know that, they don't need to be in the medical field. So, I mean, we just wanted to offer a welcoming, non-sterile, homey type clinic that where anybody would want to come. I mean, and offer those extra things that maybe other doctors don't want to do.
And I know you mentioned when we talked before too, there's some certain treatments or things that you guys are specializing in that might directly more affect our community. Could you speak a little bit to those?
Absolutely. There is a awesome new thing that the CDC approved back in March of 2014 that went through clinical trials, multiple clinical trials with gay men, along with heterosexual individuals and IV drug users, or people that were high risk for contracting HIV. It's called PrEP. In other words, a medication called Truvada, which is here in the medication thing. What it does, it's pre-exposure prophylaxis. It is a 92% effective rate to not contract HIV. However, it is 92%. There are those 8% that and we stress, and each patient that goes on it signs an agreement that we ask them to use protection. And as long as they go by that, and long as they're Their blood work is done every 3 months. Everything is good.
And I know when we were speaking before too that we talked about this sort of stigma that comes along with that. And I've had folks on the show before. We've talked with CARES and some other providers that are pro, PrEP and Truvada, and feel like any type of assistance that's going to keep the infection rate down is great. But there's also been that sort of negative stigma thrown onto it, like, oh, well, you're on that, you must be, easy, or you must, and that's not always the case.
That is not the case.
And so that makes people nervous about asking for it. And
I'll give you a perfect example, without violating anything. There's
HIPAA is watching.
Absolutely, that's not what I want to violate. However, but this needs to be said to the doctors that say that there's not enough clinical trials. Those individuals are right-wing individuals that don't want to use it because they want to continue to keep getting that money and not prevent it. It is let's say your partner is positive. You want to be intimate with your partner without getting...
Right.
You want to protect yourself. Anybody should have the right to protect themselves, whether they be gay, lesbian, straight, or what. It doesn't matter. They should have that right, have that opportunity to get it. But
now, one of the other things you mentioned that I thought was helpful too, and we've got about a minute left and we'll speak to this and then head over to the contact info. Physical, something as simple as a physical that oftentimes can be a little bit heart-wrenching for folks who maybe don't fall within the parameters of what they would consider, sort of going to a normal physician. How do you guys sort of handle that?
As in,
I'm just saying how you make people feel comfortable. Like, I know we've had trans members on before that have talked about how they'll go and they'll have to explain that.
We deal a lot with trans care. We have a lot of trans care patients.
So you have that experience in working with them.
I mean, everyone is treated the same.
Cool.
And they are...
I don't mean to cut you off. We got about 30 seconds left, and we want to get the full screen up of where folks can find you.
Right, absolutely.
And that'll be up here in a sec. But I know you guys are in Old Hickory. You're on Lebanon Road.
Yes, sir.
Oh, there's the info right there. So 4977 Lebanon Pike, 615-288-4470. Of course, you can find them on Facebook, and you can get to all this info through there and their website as well. But listen, thank you so very much, Kevin.
You're welcome.
I really appreciate you coming
me.
and doing this. I know it's a good service for the community.
Now, like us on Facebook.
Listen, thanks a lot. We appreciate it.
No problem.
And when we come back, Chuck talks with Jacob York, one of the stars of the new Matt Riddle-Hilver movie, Paternity Leave, in the Entertainment Outlook. You won't want to miss it, so stay with us.